You know, you'd think that only in Nazi Germany would people come tearing down your doors and arrest you for using the medication that keeps you alive.
You can get all kinds of things. He got drugs that could kill him, but he couldn't get marijuana.
If I am just one of many people, I mean, I'm a functioning handicapped person, but there are many other people I know that could benefit from medical marijuana.
In the following presentation, we will be hearing from several of our Arkansas neighbors who use marijuana to stay alive. Their personal stories reflect the experiences of Americans nationwide who have witnessed firsthand the healing power of medical marijuana. The earliest evidence of human use of marijuana was discovered by archaeologists in a cave in China. Seeds and fibers were excavated, among other relics of human settlement, dated to around 10,000 years ago. By 4,000 years ago, the official Chinese pharmacopoeia listed marijuana as one of 3 herbs given by the gods for human comfort. Since then, marijuana, also known as cannabis, has been used as a medicine or a sacrament by most of the world's civilizations. But it wasn't until the European Renaissance that cannabis became known in the West. By the early 1800s, an increasing number of physicians and scientists in the United States had become enthusiastic about the therapeutic properties of cannabis. American doctors prescribed cannabis extracts for over 100 ailments. But with the development of synthetic drugs, herbal remedies fell into disfavor.
We need to have more control over our lives.
I think that patients ought to have anything that makes them feel better. Anything that they need, they ought to be able to have.
You have to be really brave nowadays to survive in the United States if you've got medical problems.
In 1937, the United States government enacted the Marijuana Tax Act, which prohibited the use of marijuana for health care, despite pleas from the American Medical Association. During the Reagan and Bush administration of the 1980s and the Clinton administration of the 1990s, the war on drugs escalated to unprecedented extremes. In 1989, a federal lawsuit demanded that government reschedule marijuana to a less restrictive category, allowing for medical use. The Drug Enforcement Agency's administrative law judge, Francis Young, studied over 5,000 pages of research and heard testimony from several experts. He concluded that the DEA should reschedule marijuana for medical use, declaring that marijuana was one of the safest therapeutically active substances known to man. Judge Young's ruling was ignored. As of 2002, 9 states have passed laws allowing for medical use of marijuana. Contrary to campaign promises, the current Bush administration has ordered federal agencies to overturn states' rights, creating a climate of confusion and fear for doctors and others attempting to improve patient quality of life. U.S. Navy veteran James struggles with this inconsistency of state and federal policy.
Well, most of the doctors that have seen me there for the medical problems for which I use marijuana have told me they're not allowed to really talk about it at all. Most of them have just told me to keep doing what I'm doing because it works and nothing else they have has. Now, the second doctor on there, well, it was just last year, who reevaluated me and told me he didn't think I should have to, live in fear of being arrested using the only thing that's been found so far to keep me alive. Twice I had the opportunity to speak before a committee of the state legislature that was considering a bill to legalize access to medical marijuana. It was a really scary thing to do because, I was sure, I was going to get arrested once somebody saw me on TV or whatever talking about, I used marijuana for this and this and this. Yeah, that old saying, I love my country, but I fear my government. Yeah, that's true.
If I were still practicing medicine, the laws of the state of Arkansas wouldn't allow me to prescribe the smoking of marijuana for my patients, even though it might be the least costly and most effective form of treatment for their particular problem. Make no mistake, Lots of physicians feel the same way I do about these irrationally restrictive laws. Some even quietly suggest to their patients that they might try marijuana to relieve their symptoms, but they can't help them to legally obtain that marijuana because for them to speak out would threaten them with loss of their medical license. If an individual stands to benefit from the use of marijuana and is willing to risk its use knowing that it has not received FDA approval, that decision should be between the patient and his or her physician. I fully support whatever reforms are necessary to make this important substance legally available for medical use.
Pain relief is one of the oldest documented uses of cannabis. Marijuana is an effective, non-addictive pain reliever for catastrophic injury such as spinal cord damage and amputation, for chronic migraine, neuropathy, and generalized pain. Research shows that cannabis is uniquely effective for conditions with crippling and painful muscle spasm, such as multiple sclerosis, cerebral palsy, paralysis, fibromyalgia, and post-polio syndrome, such as GENES.
Have been diagnosed with what they call post-polio syndrome. It's like that the damage that was caused at the time that I originally had polio it never really healed. It's almost like having polio all over again. I don't feel good. I just basically don't feel good. I take doxepin and Klonopin. I take Darvocet. I've had to stop taking some medications because I've had problems with my stomach. What I found that with medical marijuana, that initially I could feel a change in my body. For one thing, it helped me relax. Overall, it just gave me a better feeling. I felt less depressed.
Marijuana is best known for its use by cancer patients undergoing chemotherapy or radiation treatment.
Well, I was the caregiver for Jim Trost, who died in August of 1994 of colon cancer. He was a psychologist. He taught at UALR, University of Arkansas at Little Rock, and taught in the psychology department, and enjoyed that very much. When he was diagnosed in February of 1993, he went through the normal processes that cancer patients go through. Initially, he had a surgeon who removed a tumor, and he had chemotherapy and then later radiation. He needed to eat. He was skinny anyway. He started out about 135 pounds and went down to probably less than 100. He didn't want to know at that point. He wanted to be normal. He didn't want to be sick. So I think he went to a fast food restaurant and got a milkshake, and he came home and threw it all up. That I can't remember what it was right now that he was prescribed for his nausea, but it didn't work, whatever it was. After he died, I found pills under the mattress. So in order to deal with the nausea and to eat, we talked about a lot of alternatives, and he chose to use marijuana. The marijuana was very helpful in reducing the nausea and allowing him to eat and digest his food.
Historically, cannabis was prescribed for constipation, loss of appetite, and nausea. But all kinds of digestive disorders, including ulcerative colitis and Crohn's disease, are effectively treated by marijuana.
I was in the Navy for a little over 4 years. I was trained as an electronics technician and a reactor operator. Well, I only have a few symptoms. I have no appetite at all. I get very sick and nauseous from eating anything. I have chronic diarrhea that none of the medications they've tried have done anything to alleviate, and no matter how much food I eat, I just lose weight. They've gone through numerous possible diagnoses. They've tried all kinds of drugs, several procedures, and nothing has worked at all. They've only tried maybe 15 or 20. Well, I've met people that have tried a lot more.
It's still a lot to deal with.
Yeah, I feel like a guinea pig at times. Just before I made the decision to start using marijuana, I had gone down from from 200 down to 130 pounds. And I have sort of a large frame, so I looked really, really emaciated and bony. And, well, having my doctors tell me that I should prepare for a funeral because they had no other medical options for me was my first clue that I needed to find something myself. And then having one of the doctors pull me aside and ask me if I had ever heard of marijuana, but sort of gave me, I guess, an opportunity to find something else. It took me 2 more months to make the decision to start using marijuana, which was not a medical decision for me. It was a religious decision. If God decided it was my time to go, then, you know, I didn't have any problem with that. God was telling me to go ahead and try something that He had to offer. When I finally did try it, it was really amazing to me because I gained 28 pounds back the first month after losing 70 pounds over a course of a year, or actually 14 months. It took care of every single one of the symptoms I had. I mean, sometimes it's almost like I've got a normal appetite.
The latest drugs for treating HIV/AIDS cause terrible nausea and wasting syndrome. Consider the testimony of one man in his struggle to stay alive.
My name is Greg, and I am 36 years old. I've lived in Little Rock since 1984 as a law consultant with a major law firm. I was infected with HIV in 1985. I now have full-blown AIDS and AIDS-related myelopathy. I am virtually paralyzed from the waist down, have no bladder control, and have numerous digestive disorders. After I could no longer depend on or regularly afford marijuana, my doctor allowed me to try Marinol. I started with 5 milligrams a day and now take 10 milligrams a day.
Arguments against marijuana usually involve the mention of Marinol, which is a synthetic prescription drug that duplicates the chemistry of marijuana's most active ingredient, delta-9 tetrahydrocannabinol, more commonly known as THC. But THC is not the only active ingredient in natural marijuana. Recent studies have shown that other active ingredients in marijuana reduce the intoxicating effects of THC. Marinol must be swallowed, which doesn't work for people who are vomiting. It takes much longer to take effect and costs up to $1,000 per month.
My main complaints about Marinol are that it keeps my mind foggy or stoned for most of the day. While Marinol helps, my life would be so much better with the dosage control that marijuana provides. Legalizing it for medicinal use would also make it more readily available, and I would not have to put friends at risk of prosecution for helping me.
This amazing plant is recommended for depression, seizures including epilepsy, Tourette's syndrome, and other brain disorders.
And if you know, I know, that there's something that can help me, make me feel better, then I'd like to be able to have that.
I think anybody that has been around a sick person would just do anything they could to help them. I really think that the people in Arkansas want to help sick people, not make things worse for them. Anything that works, we need it.
I said, you know, if the only way I was going to be able to get any peace and be able to, you know, be able to really handle this was to try to find some way to make it legal. I got really tired of being afraid.
The patients featured in this presentation are just 5 of the thousands of people across Arkansas and the nation who struggle every day with the conflict between what they need for their health and the threat of arrest and jail. Recent surveys have shown that 66% of Arkansas people believe the law should be changed to allow for medical use, a promising sign that reform is on the way. For some, it can't come soon enough.